Are you breastfeeding or exclusively pumping and you have this weird breast pain or nipple pain? Well, this is the video for you to help you pinpoint what it could be. Mommy Shark here. You might be experiencing some kind of pain and you are wanting to go to a doctor, but meanwhile you're thinking, what could this pain be? There are 4 different kinds of breast or nipple pain that a breastfeeding or pumping mom can feel. And of course, guys, this is aside from cancer or anything that's a little bit more serious than that. So definitely make sure to check in with your doctor on any of this. This video is for informational purposes to maybe just help lead you down the right direction when it comes to your nipple pain. The first kind of pain that you may be feeling is just the first few weeks nipple pain, where your nipples are just adapting to being either pumping or to a baby latching on. And of course, anybody that's just started breastfeeding will experience some kind of soreness. And that's just because your body needs time to adjust to a breastfeeding baby and all the fun stuff that comes with that. It's usually just soreness and tender to the touch, but there's no stabbing or shooting pain, and there's no wounds or open skin, and might be associated with some dry skin. So you can usually resolve that with using some coconut oil or olive oil in between sessions. Definitely use only safe creams because you don't want to expose your baby to anything that is dangerous. This soreness usually lasts just a few weeks, and it comes and goes, of course, with maybe putting on your bra or at the beginning of each breastfeeding session, and it usually goes away in a few weeks. Now, when it comes to a different kind of pain, the pain of a letdown, some women experience pain with letdown, and a letdown is when your milk actually starts to come out of your breast, and usually you'll probably feel it when it's time to pump or when it's time to breastfeed, or you usually feel it when your baby is crying. Your body actually reacts to that and you experience a letdown. So the letdown feels like a tingly feeling, even like pins and needles in your nipples, and it usually goes away within literally 10 to 15 seconds. So it usually goes away really quickly, and you know that that's a letdown. It's something that you're going to easily distinguish in the future as you learn how your letdown feels like. Now, the next 2 kinds of pains are a little painful to talk about, because one is going to be thrush pain, which is a yeast infection, and I actually have a video that goes into detail on how to avoid and prevent and treat thrush infections of the nipples, because they are vicious. They will recur, especially if you're passing it on to your baby and your baby is passing it back to you. So definitely check out that video if you're interested in learning more. Thrush pain can be a few different kinds of pains, okay? You're going to have possibly burning nipples, and you might have flaky skin. For me, because I actually lost skin to my baby's tongue tie, I lost some skin, so I had a white film on top of my nipple. So that's how I immediately knew I had a yeast infection, because it created that white film that cannot be scraped off. But then I learned after my nipples healed and it kept recurring, I learned what that feeling feels like. It was really a burning feeling. You have painful breasts and nipples without any hard lumps. If you have hard lumps, that's usually clog pain. So you just need to unclog your milk ducts. So that's a different kind of pain that can come with mastitis, which is the 4th type of pain. But going back to thrush pain, you might have some stabbing pain behind the areola, which is that pink skin around the nipple, and you might be itchy. So now moving on to mastitis pain. A clogged milk duct, it usually feels like a lump in your breast, and when you feel it, it is usually so painful, and that's how I immediately knew I had a clogged milk duct. I also have a very detailed unclogging your milk duct video where I talk about how to unclog it right now and different things you can take, and some probiotics that you can take to avoid that. Definitely check out that video if you're interested. Now, what happens when your clogged milk ducts do not get relieved is that stagnant milk can cause a bacterial bacterial infection, which is mastitis. Mastitis is painful. If it gets really severe, your breast will have really red streaks and it will be like in a red skin wedge shape. So that's how you know immediately you have mastitis. And it's usually associated with flu-like symptoms. So women usually get fevers and it start feeling achy all over. So that's how you know you might have mastitis. Now for mastitis, you definitely need an antibiotic. For thrush, you might need an antifungal cream or APNO cream. Again, check out the video for more details. Or you might just need to go directly for hard medicine like diflucan. So definitely those two cases, you need to go to a doctor and get those two situations diagnosed as soon as possible. I hope this video helped you get a better idea of what your nipple pain could mean and how to proceed from there. And you are awesome. Remember to be a shark.